Twinsta is used to treat high blood pressure, also known as hypertension. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. This medication contains two drugs, Telmisartan and amlodipine. Telmisartan is an angiotensin receptor blocker, ARB, and amlodipine is a calcium channel blocker. They both work differently to relax the blood vessels so that blood can flow more easily. These medications are used together when one drug is not controlling your blood pressure. Your doctor may direct you to start taking the individual medications first, and then switch you to this combination product if it is the best dose combination for you. The usual recommended starting dose of Twinsta is 45 mg once daily. The optimal timing for taking this medication may be in the morning, but it is best to follow your doctor's instructions for the best time for you to take it. Before you start taking Twinsta, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. The dosage is based on your medical condition and response to treatment. Use this medication regularly to get the most benefit from it and try to take it at the same time each day to help you remember. Keep taking this medication even if you feel well, as most people with high blood pressure do not feel sick. It may take up to 4 weeks before you get the full benefit of this drug, so be patient. If your condition does not improve or worsens, make sure to inform your doctor. As your body adjusts to Twinsta, you may experience dizziness or lightheadedness, as well as swelling hands/ankles/feet or flushing. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, you should tell your doctor right away if you experience any serious side effects, such as fainting, fast/pounding/irregular heartbeat, signs of kidney problems, or symptoms of a high potassium blood level. Some people with severe heart disease may rarely develop worsening chest pain or a heart attack after starting this medication or increasing the dose. If you experience these symptoms, seek medical help immediately. While a serious allergic reaction to Twinsta is rare, it's important to seek medical help right away if you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, contact your doctor or pharmacist. This medication can cause harm to an unborn baby if used during pregnancy. It is important to prevent pregnancy while taking this medication. Consult your doctor for more details and to discuss the use of reliable forms of birth control while taking this medication. If you are planning pregnancy, become pregnant, or think you may be pregnant, tell your doctor right away. Before taking Twinsta, it's important to talk to your doctor or pharmacist about any allergies you may have to Telmisartan, amlodipine, or other calcium channel blockers, as well as any inactive ingredients that may cause allergic reactions. It's also important to discuss your medical history, including any liver disease, high levels of potassium in the blood, dehydration, heart disease, or bile duct blockage. This medication may cause dizziness, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how Twinsta affects you. Additionally, excessive sweating, diarrhea, or vomiting can make you feel lightheaded, so it's important to report prolonged diarrhea or vomiting to your doctor. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Twinsta may increase your potassium levels, so it's important to consult your doctor or pharmacist before using potassium supplements or salt substitutes that contain potassium. Older adults may be more sensitive to the side effects of this medication, especially dizziness and changes in urine production. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the potential risks and benefits of using Twinsta. This medication may harm an unborn baby, and it is unknown if it passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Twinsta. These interactions could change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Twinsta include aliskiren, lithium, and drugs that may increase the level of potassium in the blood. It's important to also be cautious of products that could raise your blood pressure. Be sure to tell your pharmacist what products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. If someone has taken too much Twinsta and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Symptoms of overdose may include severe dizziness, fainting, and a fast heartbeat. It is important not to share Twinsta with others. While taking Twinsta, it is important to have regular lab and/or medical tests to monitor your potassium levels and kidney function. It is also important to attend all medical and lab appointments and consult your doctor for more details. In addition to taking Twinsta, lifestyle changes such as stress reduction programs, exercise, and dietary changes may help the medication work better. You should talk to your doctor or pharmacist about lifestyle changes that might benefit you. It is important to have your blood pressure checked regularly while taking Twinsta. You should also learn how to monitor your own blood pressure at home and share the results with your doctor. If you forget to take a dose of Twinsta, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to store Twinsta at room temperature, away from light and moisture. Keep the medication in its blister pack until right before you need to use it, and do not store it in the bathroom. Remember to keep all medications out of reach of children and pets. When it comes to disposing of Twinsta, make sure not to flush it down the toilet or pour it into a drain unless you're instructed to do so. When the medication is expired or you no longer need it, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.